We're starting today by talking about a condition that affects approximately 900,000 people every year. March is Deep Vein Thrombosis Awareness Month, and here to help us understand it is Dr. Wikholm with Inovia Vein Specialty Centers. Welcome.
Hi, thank you. Thanks for having me.
Yeah, thanks for coming. So 900,000 people is a lot, and it can happen to anyone. So first tell us, what is deep vein thrombosis?
So the deep vein is a vein that's larger and it's under the muscle. And thrombosis means a blood clot. So it's a larger vein under the muscle, a blood clot, and they can potentially be life-threatening depending if that blood clot moves.
And this is mostly in legs or?
More commonly in the legs. Occasionally it'll occur in the arms. Usually that's related to an IV during a hospitalization.
And since this often goes undiagnosed, I mean, what are the typical signs and symptoms?
So about 50% of people will have symptoms, 50% of people might not. And so it's good to know the symptoms so that way if you were experiencing this, to get it diagnosed early. So you could have redness of the skin, and again, typically this is in the leg. Acute swelling, typically it's in one, and acute means that it happens suddenly, so sudden swelling of one leg, and then also pain often in the calf or tenderness of the calf.
So because people don't always exhibit symptoms, are different people at different risks? How can you help people with that?
Yeah, absolutely. As you mentioned, it can happen to any age, but there's certain factors that put you at higher risk. So some of those factors that are something that you may be born with, like a family history of a blood clot, and some of those factors cannot be changed, like if you have cancer or pregnancy, or another one is a leg injury. So if you had a surgery on the leg or fell and injured the leg, those increase the risk of a blood clot. But some of them we can intervene on, and those would usually be immobility. So what immobility means is not moving around, and think of flights longer than 4 hours, or if you're sitting in a certain painting or doing a project where you're crouched in a tight space for many hours, that's immobility. As well as being hospitalized and being bedridden.
So what are the short and long-term risks of a deep vein thrombosis?
Yeah. So short-term, what you can have is the entire leg gets extremely swollen and painful, even difficult to walk, as well as part of the clot could move to the lungs or even the brain, causing a stroke or pulmonary embolism, and those potentially could be life-threatening. The majority of cases don't have that happen because hopefully we can diagnose them and treat them, which lowers the risk of those more serious complications.
Well, yeah, talk about how you diagnose and treat it.
So partly by exam and history. So we figure out if someone's at risk for this, if it looks like based on exam they have the condition. And if they do, then we'll get an ultrasound. And ultrasound is the best way to diagnose it.
And that's what we're seeing here. And it looks fairly painless, at least the ultrasound part, right? Okay, that's good. What other conditions do you treat at Inovia Vein?
So we treat all things vein, which include the deep veins, but also superficial veins. And I know superficial veins sounds like maybe you would see it, but in about 20% of my patients, you don't actually see the superficial veins. What it means is a vein above the muscle, but under the skin. And so when it is in that level, sometimes you see it, sometimes you don't. And sometimes the symptoms might be aching, heaviness, or even skin problems.
And talk about varicose veins a little bit too, because that's not always a cosmetic thing. That can cause pain and things in people too, right?
Yeah, absolutely. Because I like to think of a lot of vein problems related to traffic. So a blood clot is like an accident and you closed the I-5. Varicose veins are just traffic. So there's still flow, but it's really sluggish and it's not healthy for your body to have bad circulation.
When you put it like that, it does help me understand for sure. Okay, well, where can people book a consultation with you?
So I work in Happy Valley at Inovia Vein, and we have 4 offices throughout Portland. I believe the phone number is being displayed, so 1-800-VEIN-DOC, and we're going to be opening our next office on the Vancouver side later this year.
Well, how exciting. So we'll look for that.
Yeah.
Thank you, Lauren, for coming.
Thank you.